Hello and welcome to our very first edition of our digital discussions. Hello and welcome to the second iteration of our e-Estonia digital discussions. Today we have a very exciting topic. It's at the front line of digital health. My name is Florian Marcus. I am a digital transformation advisor at the e-Estonia Briefing Center, and we have many exciting presentations and discussions today. We will hear from our very own experts at the e-Estonia Briefing Center, and we also have some presentations from companies that deal with the e-health around the world. At the very end, after the presentations, we will have exciting breakout sessions where you get to ask the experts some more detailed questions as well. Before we delve into all of these different exciting topics, I want to talk a bit about our platform that we use. It's called WorksUp, and there are many options that you can choose from, and I encourage you to use that platform as much as you can. First of all, you can fill out your own profile, which we very much encourage, so you can find other people that work in the same field, so you can make contacts both in your own country and in other countries around the world. Second, if you click on tasks, you will find some of the polls that we will raise over the next few minutes and hours. So we will ask you, the audience, some questions, and you can answer what you think is the most appropriate point for you. Under the Q&A section, you can submit your own questions to the person that is currently doing the presentation, and after the presentation, I will ask those questions on your behalf. You can also upvote the questions that other people have raised if you really want to hear that particular answer. Without any further ado, I would like to introduce to you the very first poll, of course. And the question that we have is, which e-health services are most needed in your country? There are a few options: e-prescription, video consulting, e-booking, or online medical records. You can take the next few minutes during the upcoming presentation as well to think about your answer. But while you think about that, I would also highly encourage you to, of course, follow the presentation that will be done by no other person than my own boss. It is Anna Piparal, who is the Managing Director of the e-Estonia Briefing Center, and she will talk about healthcare during the pandemic and beyond. Let's take a look.
Where is the best place for health innovation? In Estonia, a land with a unique digital ecosystem where 100% of clinics are connected. All the data is equally accessible for healthcare providers and citizens. The e-health system integrates all healthcare providers and shares defined medical documents of all patients. The system incorporates electronic health records, digital image sharing, digital prescriptions, and a variety of other e-health applications. Today, more than 99% of prescriptions are issued and transferred digitally. It allows access to medical data online in a secured and trusted way. No data leaks or serious privacy violations have been reported since its implementation. 10 years of real e-health experience has made Estonia a unique platform for fast implementation of future e-health services. Our expertise is guaranteed through the dedicated e-health curriculum where future e-health implementers are created, the first of its kind in Europe. Come and collaborate with our universities, clinics, industry and startups. Launch your next big e-health idea to Europe.
Good morning. Many keep saying that the world will enter a new and different reality after COVID. But what does this new reality even mean for the governments and healthcare systems around the world? So, addressing the pandemic, the whole world is focused on solving the disruptions in public services provision, and most importantly, healthcare that is under a great overload today. Digital technology that we use for healthcare services has helped Estonia to solve and cope with the crisis better than many, and digital technology has become key to a well-functioning and resilient e-state. So how can the state guarantee minimum disruptions in the public services provision in healthcare and keep people safe at home or anywhere else? And how many countries in the world overall can provide a full range of public services securely and digitally? My name is Anna. I'm an e-governance expert, e-Estonia Briefing Center Managing Director, and a TED speaker. And today we're talking about e-health in Estonia. It is clear that the demand and cost of healthcare services around the world is naturally and exponentially growing, and that due to factors of aging population and the chronic diseases. When we add to the pot the uneven distribution of these services and access to them, and also the uneven quality of healthcare services, this problem becomes bigger and bigger. In the face of a pandemic crisis, all of those issues combined present an ultimate stress test and could result in a potential collapse of the whole healthcare system. We believe in Estonia that even though technology cannot solve all of our problems, including the pandemic, and the types of crises are unlimited, but it definitely creates way for increased efficiency, accessibility, and the quality of healthcare services, and also gives more control to the patients themselves. But before we're going to dive in Estonian health tech, there are some things that we have to set straight. First, it is important to explain that Estonian healthcare system is based on the solidarity principle, which means that healthcare services are available to everyone. And let's not forget the fact that the way we design all of these e-governance services, 24/7, anytime, everywhere, which means a digital service is our top priority. And thirdly, the transparency and accountability of the system is essential and critical because in this case, if it's there, everyone can trust the system they're using and trust the data that they're relying their decisions on. Another world-changing principle is answering the question of who owns the data. For many countries, this could be surprising and unexpected or even unacceptable, but in Estonia, the patient's data belongs to the patients themselves, not the hospitals or healthcare institutions who have collected and analyzed that. Giving patients control and access to their own data makes a whole big difference, not only in their trust and the way how people are using the system, but also it has crucial impact on the quality of services that are provided and the unprecedented level of transparency and accountability. So how are we doing this in Estonia? To address the issue, we have to talk about three major pillars, let's say generalizing the whole concept. First of all, confidentiality, which is a key step to provide secure access to the most valuable and sensitive data, our health data. This is enabled thanks to the digital identity, which in different options, cover majority of population in Estonia. So whether it's ID card or mobile ID or smart ID, these are the ways how people are accessing the data. They can control who is else accessing the data, or they can decide to restrict it. The same way healthcare employees will be accessing the patient's data, and there is 5 different levels of access to the data from the healthcare employees' side. Another aspect is availability and the data exchange. So thanks to the data exchange layer called the X-Road, different institutions can access to the medical health record of a patient collected from different sources. So they can rely on an adequate data, and they know that this is the true one collected from different hospitals. And of course, third, not least, of course, is the integrity of the data and system, which is guarded by a KSI blockchain technology. In a way, this technology provides an ultimate accountability and transparency and guarantees that the integrity of the data itself, the health data about patients, the log files, and all of these rules have not been manipulated. So no one would be able to delete your blood type or delete your allergies or fake records without becoming known. And of course, the log files, after each visit, the doctor is revisiting the information, the log file is saved, and the patient has a full transparency on who has seen his personal information in healthcare system. Can you imagine any of this being possible on paper? I didn't think so. And of course, in Estonia, we have not been preparing for all of that just during the pandemic. It wouldn't be possible. In fact, we have been preparing for that for the last 20 years. First, when we enrolled the X-Road system that is allowing the data exchange between different public and private sector institutions back in 2001. 2002, digital identity and digital signature came about and allowed secure access to the private data into different governmental institutions. E-health system, the first version of it, came about in 2008, and since then, all the different hospitals and health institutions started to produce digital records to the system. E-prescriptions from 2010, in just 2 years, the use has skyrocketed up to 90%, so this is how easy the service actually is. 2018 was a remarkable year as countries, Estonia and Finland, were able to exchange the data cross-border, and this was also valid for the e-prescription information. So Estonian doctor could issue a prescription and I could easily get it in Helsinki. And the future of us, of course, lies in the personalized medicine area, which I'll talk about a little bit later. So now let's take a look at some of the healthy facts about Estonian healthcare system. There are close to 40 million digital documents in our e-health system. Public and private sector, hospitals and other healthcare services providers like labs and researchers add relevant data, different X-ray or treatment results, diagnosis, and almost everyone in Estonia has a digital health record available, almost 100% of people. Just a quick fallback. This last spring, my 1-year-old daughter had a weird rash, and I didn't know what to do in the beginning, but thanks to the system, distantly, and this was the peak of a quarantine in the first pandemic crisis, well, basically, I could get opinion from 2 professional dermatologists, just allowing them access to the blood test done in another lab about my daughter. So I got a medication for her in the form of digital prescription just 2 days after that, when they've made their decision, and I got it in the pharmacy next to my home. And this is really not fiction. This is the boring reality of life in Estonia. So what did we have to do and change due to the COVID? Of course, Corona app, Hoia, that's present in many countries. Our app is unique as it's anonymously tracking mobile devices and informing people if they've been in contact with someone who is COVID positive in order to protect themselves and the rest of the nation. Corona Map platform was there from the beginning to track the spread of diseases and just to inform people what areas they possibly decide not to go to. And one other aspect, when there's so many people who got a COVID positive test and they needed a sick leave, there was an opportunity in the patient's portal for them to open automatically a sick leave, and the doctor would just have to validate that by looking at the research results done. So it was done much simpler to optimize everyone's work without visiting the doctor. But of course, that's not all. As I've mentioned, we have been preparing for the situation for years. And these solutions I'm going to talk about have been serving us beyond crisis, and they will continue to do so. So let me walk you through some of the key solutions we have and use. First of all, the Health and Welfare Information System Center is responsible for development of all the e-services and solutions and maintaining them. And the private sector, who you will meet today, are the ones who actually develop the services. So first of all, health data is sent to the Health Information System. This is where multiple parties not only input the data, but they can also access it simultaneously. Patient's portal would be the best place for a patient to access all of the files from different hospitals available about them, including the research results, diagnosis, and the log file. So it's used to see and control who has looked at the data and maybe allow a family member to also take a look and have access to the patient's record. E-consultation is a chance and a platform to get a professional opinion on a same problem, same treatment, so we could make, a healthier decision about our health when multiple doctors take a look. And digital national booking system, also a great invention, because on a single platform a patient could book available doctor and available specialist without calling on different places or going from multiple websites, all conveniently in one place in multiple hospitals. And of course, e-prescription, the most used and one of the most user-friendly solutions for people that allows to just cut costs not only for pharmacies and hospitals. Just calling the doctor will prolong the medication if it's any recurring one. And in a few minutes, I could already go to the closest pharmacy to pick up my medicine. So it really saves tremendous time and money. And from the perspective of the future, our priority is not only to treat people like in the rest of the world, but also to try to prevent diseases that will eventually cut costs in the healthcare system. So this will be done through a vision of healthcare 4.0 and personalized medicine. So basically it means that the genome-based analysis, and we do have 20% of Estonian population's genome in our biobank today, we will be able to analyze and not only prognose the global trends in some diseases or national trends, but give an individual advice to a person based on his inherited genome information. So he could overlook and maybe oversee and change some of his lifestyles or the environment he is in to stay healthy longer. In this case, everybody are a winner, the nation is more healthy, and the costs in the healthcare system decreases. So to finish off, really, what can we learn from the pandemic crisis, and how can we take advantage of it? Considering the large-scale trust crisis around the world with this pandemic, and people are worried whether the government has the capabilities to actually fight it and whether the hospital systems will endure, considering the demand the citizens already have for services and their readiness to use digital tools. I personally believe that the plans and discussions about building digital services in healthcare should rapidly transform into action plans. Healthcare is now a top priority area and is crying for innovations at the moment. So let's seize this opportunity to build a healthier healthcare systems together. Estonian renowned experts from the companies who have built digital solutions that served us for years are going to be here today to share their insights with you. Thank you very much.
Well, thank you so much, Anna, for your presentation. Very insightful stuff for all of us, I'm sure. We actually would like to move to the very first poll already, and I'm very positively surprised. We already have 92 answers for the first question. To remind you, the question was, which e-health services are most needed in your country? And we see quite an even spread between all the different answers, but the winner is definitely online medical records. I personally think that's a very good place to start because obviously it creates the foundation for better treatment options from both general and special doctors as well. What are your thoughts on the polling answers that you see on the screen?
Of course, definitely online medical records is the first step to start off, and there are countries that basically people have to collect piles of papers and transfer them to different hospitals, and like you can't imagine what is the work the doctor has to do to just process all of that. It's just not humanly possible. So online digital health record is definitely #1 for me too.
Very well, I couldn't agree more. But we also have plenty of questions from you, the audience, in the Q&A section. We only have 9 to 10 minutes for this part, but we will try to deal with as many questions as we can. The first question would be, what was the hardest plan in implementing the e-health solutions in Estonia?
Mm-hmm. So as you know, building the technology is not the most complicated part. You have to have the legal framework. But for Estonia, I think maybe just, humanely, the doctors who are usually more mature people and they're not so open to innovations, this could be one of the most complicated parts, to educate the employees in the hospital, to convince people on how to use these digital tools and how they would benefit them. So to avoid this kind of resistance, because resistance internally in organization to take up some innovations is usually one of the main, blocking points for that.
I guess it is tough in a way to be a doctor for 20, 30 years and then all of a sudden there's a government that comes around and says, how about adding computers to every single thing that you do? And I think at the start there were some people who thought that this would take time away from patients, cost more money, but then over the next few years doctors figured out that it actually does quite the opposite, that you have more quality time with patients as well. One organizational question that was being asked as well, will we be able to gain access to the presentations? The answer is yes. So in a follow-up email after the digital discussions event, you will have both a recording of the event itself and you will also get access to the presentations if you registered in advance. Now here's another question. I'm guessing this will be a common theme for other presenters later today. Are you consulting other countries to implement similar systems?
We definitely do. Not particularly our institution, but we know who to connect you with. Estonian experts have been consulting other countries, obviously, because our tailor suit is designed for us. But as major IT companies also have built the solutions, are service companies. So they are the ones also to professionally consult on how to build this thing in your organization or in your country.
And the great thing is that we've got those companies in many countries, they don't have a lot of experience because the government doesn't let them try their services, whereas in Estonia we've got e-health solutions that have been working for more than a decade already. So certainly worth taking a look at. Another good question. How did you teach and convince older/less technically ready people to use e-services?
Well, it took some time, definitely. There is no red pill that we can give you. There was different measures and campaigns focused on teaching older people and like free courses, 2-day courses on how to use email, how to use computers, how to use the search engine and what can you do with it. And also for e-services, there are large campaigns on the Tiger Leap Foundation that were kind of teaching people and organizing kind of a more engaging ways on explaining them what they could learn and how they could use the digital services. And of course, this means you have to design services that are user-friendly and easy to use, so even an elderly person could use. For example, e-prescription would be a great example of the easiest user-friendly service, because all you have to do is call the doctor and say what you need and then hand in your digital identity card in the pharmacy. So this is 0 skills you need to gain additionally.
I think that's a very good point. It's not the most glamorous answer in the world, but the truth is that very often it comes down to education and user-friendly services. Exactly as Anna said, if you have an ID card and you just need to show up, you don't need to press a single button, you don't need to click anywhere or enter anything, that makes life easier for all groups in society. Let's take another question. Precision medicine is a revolution in healthcare systems, including diagnosis, tracking, and treatment. Do we see using tracking apps like the one that we are using right now in this pandemic even after? And how are we going to deal with the privacy issue? It's a long question, but good question.
That's a good question. And we can see that the screws have been, kind of put in many countries who have these apps, and there is a lot of people who don't understand how potentially this could be used, and it could be used as a weapon for sure. When it comes to Estonian Hoia app, it is completely anonymous, tracking not people, but the mobile devices, and this is like a bunch of just codes that have been near to each other. So there is absolutely no link to a person or his diagnosis directly. So we made sure that, in fact, I think Hoia would be able to use for any pandemic issues or iterations if we have them, but not particularly to kind of continue using that for other purposes. I think it's really important, to keep the trust of the citizens, because all the e-governance is actually based on the trust and transparency that in many countries is not present.
I think actually I fully agree. I was at the start I was a bit upset that Estonia was not the first country that came out with a COVID app or contact tracing app. But the truth is that some countries started a bit too fast and didn't explain to the population what were the privacy and data safety and security frameworks that were being used. So part of the population wouldn't use it. So this is also very important to bear in mind. We'll try one or two more questions. One that I very much like. My country has only 250,000 people. Is the e-health system too big for such a small society? We only have one main hospital and a number of private smaller ones. I like that question because usually the question comes from the other side. What if our country is too big? But maybe a good question. What if our country is smaller than Estonia?
Well, if your country is smaller than Estonia, it means that you have to invest much more in order to have a functioning systems or government services. So anyways, digital solutions and services will be for you a way to reduce the costs and on a long term better the quality and kind of match the demand from the population side. And if case anything happens to your small place or location, when, for example, people have to move, let's say if there is a chemical catastrophe or any natural disaster, this might mean that the whole nation will have to, or half of the nation will have to move out. So how will you be able to service them therefore? Or let's say if some other country would like to help, and there are doctors internationally who also provide services and consultation online, they could take a look to the same data. So there are many reasons why you should consider doing that, and there is no country too small, because it just will be creating a long-term effect rather than cost.
We will take one last question for now, maybe try with a nice short answer. What is the governance structure to safeguard medical records so that the wrong doctor can't look at the data and so on? How do we do that in Estonia?
The key point to e-governance and also healthcare system is confidentiality. This data is one of the most critical, crucial, and the most sensitive also by Estonian legislation, which means that without the strong identification element, like an ID card, so a cryptographically based two-factor authentication, you actually need this in order to give access to the private data for citizens and also to restrict the access to the data by healthcare employees. So every doctor and health professional will be using the same strong digital identity. So there is going to be a log file saved about his every access. And the patient who has the full transparency onto the log file is able to see that this doctor has been looking at this piece of information. And if it was not authorized, let's say it was not your curing doctor, you don't know this person, then these cases already have happened in Estonia that you can take it to court, and log file is your proof that can be enforced in court to prove that someone has violated your privacy. And this is not possible on paper, never.
And it's very important to point out also that at the very start, when the system was implemented, some doctors lost their license for life over such issues. So it's not like it's some sort of paper rule that is not enforced. No, we take it very seriously in Estonia.
Exactly. Also. You don't study 10 years, to lose your license over a few wrong clicks to just, treat your curiosity.
Absolutely. Well, Anna, thank you so much for being with us. And we are heading towards the next presentation. But before we do that, we need to talk about the second poll as well. The question is, what should blockchain primarily be used for? Is it A, buying cryptocurrency, ensuring healthcare data security, monitoring supply chains, or D, building with Legos? I know what I'm going to vote for sure. While you have a think about that, I would like to introduce to you our second speaker. It is Ain Aaviksoo, who is the Chief Medical Officer at Guardtime, and he will talk about everything that Guardtime does in the area of e-health. Let's take a look.
Guardtime is a cryptographic engineering company founded in 2007 in Estonia to solve the data integrity challenges first faced by the world's most advanced digital government. Our purpose is to make the world's information universally reliable and globally verifiable. Guardtime's zero-trust solutions today power mission-critical applications for global companies and government bodies in Europe, the US, and Asia. Guardtime's Vaccine Guard is a GDPR-compliant end-to-end solution that can make vaccination certificates digitally verifiable everywhere in the world. A government hospital captures the unique vaccine serial number and patient identity into a certificate that will be sealed cryptographically using KSI blockchain. No personal data ever leaves the hospital, only the unique hash pattern is needed to return the authenticity seal. The only copy of the certificate outside the hospital is delivered to the patient on paper or digital, and only the patient herself can present it to the verifier, for example at the border, to prove safe entry to the country. The only external data exchange by the verifier is with the KSI blockchain solution to verify the validity of the cryptographic seal. No central database is needed to keep the list of vaccinations for verification purposes. The unique feature of Vaccine Guard is the anonymous aggregated reporting for public health authorities based on the unique combination of one vaccine dose and one person. This enables near real-time monitoring and coordination of vaccination campaigns, which is critical for COVID situation. This is the opportunity to get us together out of the crisis.
Hello world, wherever you are. Good morning, good afternoon, good evening. Being positive, staying negative. I'm happy to share with you a story from a company which is the coolest on the planet, at least I believe, which helps me to practice some of the experience that I've gained personally as a trained medical doctor, senior civil servant, and also entrepreneur. So for 25 years, I've been bridging between healthcare and IT. And I love both of them, and I haven't been able to decide which side I belong, so actually I operate and work with both of them. So what is it special about healthcare when I think of it and when I talk to the IT people, like my colleagues at Guardtime, how to help the digital solutions to become meaningful in the healthcare domain? So healthcare is sometimes complained to be fragmented. I have news to you. It's going to remain the same. Because even before this social distancing era, people were already running around with their mobile phones. And the data will always remain in different places, where the people are, where the doctors are, and increasingly so. But then again, how to make certain that my mobile phone, my primary care doctor, my hospital, and then a cool cloud service provider have all the single version of truth about me at the time when that is needed. And also, if that is to be the case, that data and care is fragmented or at least distributed, and then at the same time those different individuals and organizations need to have something that they can agree upon about me, how can I be certain that this data that is being processed by them is actually the one that I have authorized or that I am comfortable with. So Guardtime is a company which is probably best fit to address these challenges because it was born from the very same challenge. In 2007, when Estonia as a country was attacked in our cyber domain. So that instead of trying to get away from more digitalizing, we actually took it as an opportunity so that we now have a solution which enables us to prove the time, integrity and provenance of any electronic data asset without reliance of a trusted third body, a human. So how we do that is that imagine that you have a medical record or MRI scan or, well, your AI configuration file. So what you could do is that you calculate one-way cryptographic hash from that and then store that in a blockchain and add a timestamp to that and get back a fingerprint, if you will. And all this happens inside the premises of your own organization. So wherever you present that data, that electronic medical record or that MRI scan or that software configuration, the other side can independently verify that the data asset that they will be presented is trustworthy. So in healthcare, this is very, very important, that the way you use blockchain is that the data never leaves the premises, but at the same time you are capable to prove the integrity of the data about a certain time and about individual organization who actually created this. And with IT wizards, it's very often the question, how can I trust you that what I'm telling to you is actually meaningful and correct? So in our case, we have been scrutinized and will kept to be scrutinized every year because the services are certified in different parts of the world. So in my mobile phone at the family doctor's office. So the data is, as Anna already mentioned, well, protected in terms of manipulations. It's also protected in terms of who accesses that and processing in what way. And also that that information is stored and made available to, for instance, middleware software. So, which means that on a daily basis, I cannot constantly be worried about who and how is processing my data. So again, you can build automated computerized systems that help us in this very digital world where data is constantly moving. And say, for instance, the clinical trials. If you would like to access to as many people as possible, there are tens, if not hundreds of thousands of people who are currently being invited to participate in the COVID vaccine trials. Now, do you know that $5 million is 1 day of a clinical trial? And if you lose that day, next day you have to pay another $5 million. So accessing the people who are willing to participate in the clinical trials is one of the biggest challenges. Now, you could do that in such a way that you send out the request and don't exchange any data with the patient at that moment. But then when people consent to participate in the clinical trial, only then additional information will be collected and the usual workflow managed by the principal investigator follows. Now, what the integrity of the process means, that activities prior the consent and activities after the consent can be all seen as a one workflow, and you have, again, full oversight of how and when work with that data. Now, a cool thing that we came up with a few years ago is the concept of data visibility. So if there's a virtual care team, obviously they demand all the data about yourself, and it makes sense that the last day's results from the lab or the medical record or x-ray from a year ago would be available to all of them. But what if the pharma company and the insurance would like to agree that the payment to the pharma company would only be released to those patients on those circumstances when that treatment actually delivered value or the outcome was reached. So that outcome reveals itself in a real-world data environment. So doctor's office, hospitals, sometimes patients record that data. So I don't think that we would like that information to be available in a huge data lake when then all the pharma companies and all the insurances would be go fishing for the data. So how do you create that single version of truth? So what we created is a concept whereby you ask a question, agree, for instance, how many of the 100 patients who started this treatment in 6 months' time are still on treatment? They haven't developed any nasty side effects. They have followed all the doctor's orders, and all the test results are according to the treatment guidelines. And then you get a result. And that result does not require anyone to access the data, but you make it visible to them. And if the underlying data has been sealed and signed by the KSI blockchain solution, you can be certain that even without access to the data, actually the answer to your question is something that you can rely upon. That is how we understand making the data reliable. Now, I'd like to finish my story today about the product that we're working right now together with, well, colleagues and organizations around the world, and which is really, really cool. So in October, the Prime Minister of Estonia, Jüri Ratas, and Director General of WHO, Tedros Ghebreyesus, agreed a memorandum that this Estonian experience should be made available to the rest. And obviously, even though this was prepared for 9 months, by that time it was clear that addressing the area of COVID is probably something that makes most sense. So smart vaccination certificate and the way how you manage and support the enrollment of vaccination campaigns is something that we're working on right now. What the solution does. So first, you have a proof of your COVID status. Currently, this could be the tests, but in the future, near future, we heard a few days ago that the first vaccines are coming out. It would be the certificate about the vaccination. So if you go to another country and you have been vaccinated in a place that this other country wouldn't know, they need to be certain that if they allow you to their venue or to their country, that the certificate you're presenting is something that they can rely upon. But more importantly, I'm going to show you how we also help to solve one of the biggest challenges ahead for all the governments. The global COVID-19 vaccination campaign will be the largest product launch in the history of mankind. Around 10 billion doses of vaccines will have to reach to people within 2 years. Nobody has ever done this before. There are 5 to 10 different companies with their vaccines. Initially, there will be not enough vaccines, so it has to be made certain that if the batch was meant to be a country in Africa, it doesn't surface in another more richer country because they just happen to have more money. How you handle that without information and intelligence about it? So here's one way to do it. So first, there is a hospital or a healthcare provider who has been authorized by their country to provide the vaccination. In addition, now we would add them also authorization to issue a certificate about the act that they are performing anyhow. So what they do is they take photo ID, unique information about the vaccine. You should know that each vaccine vial has unique serial number, and then additional information about this vaccination context. And then you have a certificate, vaccinated, or today that would be that you're tested. Now, what we would add there is this cryptographic seal that wherever you go and present that document, the other side can base their policies and activities on it because this is reliable. This is trustworthy for them. So if the government ensures that only the authorized healthcare facilities issue those certificates, if the authorized issuer verifies or guarantees that they have looked in the eyes of the patient, looked at their photo ID and inputted the data correctly, then what we can add is the guarantee that this cryptographic seal enables you to trust this information when you see it. So how does it work in the real world? So the issuer gives the patient the certificate. Again, remember, in order to have this verification seal, no personal data needs to enter anywhere, or you don't need to keep it in any database, so that it's in the hand of the patient. And only at the consent of the patient, it will be presented to the border guard or to anyone else, and then they will verify, okay, what I see here on this paper or on this mobile app actually is something that I can trust. Again, the trust comes from the fact that it is sealed, not from the fact that I have curated some wonderful databases, even though I like those cool databases in Estonia, but I wouldn't like all the possible border guards across the world to access those databases, because for this use case, this is not needed. And the coolest thing, though, is that imagine if this vaccine travels from a manufacturer to the hospital, and the hospital gets a digital twin, as we call, together with this package, and then, as you already saw, okay, the certificate will be issued, containing the ID, information about what disease was it, the vaccine serial number, and then the hospital location, and then I will be given a certificate. At the very moment, additional, what I will call a statistical reporting artifact will be created. Notice that there is no personal information contained in that. And that information could be used for near real-time monitoring of public health authorities, how the vaccination program is going, do we have any problems in certain areas, but also in a similar manner, manufacturers would get, again, privacy-protected information about the counterfeits, the diversions, or actually in the next stage is also what is called pharmacovigilance, or the quality monitoring purposes. So that if the two dosage, you start your program with, well, the recent one is Pfizer, the first one. Then another company might also have a protocol where you need to have two vaccinations. So you have to be certain that those are not mixed between each other. And also, if anything unusual appears, again, both public health authorities and the pharmaceutical companies can act quickly. So, we are in the middle of the crisis. The vaccines are out for the first selected ones in 2 or 3 months. For the rest of the population, maybe in 6 to 9 months, and hopefully in 2 or 3 years, we get out of this crisis with the help of this vaccination. But digital solutions take time, right? So that is a reason why we agreed, when we are working now with the Estonian government and WHO, that there shouldn't be no new database created, both for privacy purposes, but also in terms of getting it actually out as expected. So there shouldn't be no IT infrastructure needed, so it's very light, it can work on top of the solutions that you have already. It has to work on paper and digital, so we can't imagine that every person in the world has the latest smartphone available in order to present that if they want to go or travel somewhere. At the same time, there has to be some minimal kind of common security and privacy guaranteed for all of them. And yes, it has to be implementable immediately and globally. So that's how we think the Vaccine Guard could help in this very moment. We have started talking to several governments. The first such certificates are being issued. The border guards in different countries where we presented them, they really enjoy that. And in the coming weeks, we hope also the WHO to come up with the request of features that exactly these kind of solutions, either from Guardtime or from others, could actually help us. So I think this truly is the opportunity to get us together out of the crisis, now and globally. Thank you.
Well, thank you so much, Ein, for your presentation. And I think it's always, I mean, blockchain is a big topic around the world, and it's always good to get some more technical insight into how it actually works, especially in the area of e-health today. Before we get to the questions from the audience, we need to talk about the poll. And again, many of you contributed. The question was, what should blockchain primarily be used for? Buying cryptocurrency, ensuring data security, monitoring supply chains, or building with Legos? What would be your answer to this?
This is interesting. Well, it could be used for many things. So it's a little bit like a mobile phone. Is it good for calling? Is it good for playing? Or is it good for, I don't know, finding your date? So I think that if you use it properly and with other solutions, actually you could use it for the things that you think you like or need.
Absolutely, yeah. It's a very versatile solution, but at the same time, of course, blockchain itself does not solve everything, but if you use it in the correct way, in the correct circumstances, it's a very, very powerful tool indeed. Let us take a look at the questions from the audience, though. Actually, something that struck me immediately is the question, how do we get in contact with the presenters? We need to have one-on-one discussions on potential projects. Greetings from South Africa. So I guess the recommendation here would be to hang out with you in the breakout sessions afterwards.
Indeed.
Where he will also tell you more about the solutions. And of course, I'm sure he will also give you his email address in addition to that. The second question, what is the main difference between Vaccine Guard and other QR code-based COVID passes?
Right, first, QR code is really just a means of communication. So QR code doesn't do the miracle. The miracle part is that first, in order to have your vaccination certificate certified and have the attestation on it, you don't need to access to any central database. So it is as privacy preserving as it can be. And secondly, it really is within that QR code, you would have this KSI signature that gives the assurance, but certainly it is compatible and could be integrated with many other QR code solutions.
Absolutely. A second question, are all medical records on the KSI blockchain, or is it only the vaccination records?
Well, okay, that's the question that I always get. The healthcare records in Estonia are never on the blockchain. Don't keep health data on blockchain, please. That's a bad idea. Use blockchain in order to secure the data, but keep your data where it is. With me in my mobile phone, like a vaccination record, or in the electronic or medical record at the hospital, so that this is the way how to use the blockchain, and this is how the vaccine records, but also all the other records are being protected in Estonia.
Very true. This is something that I also need to make our delegations aware of almost every single day. So it's very important to drive that point home again and again. Another question, and this is we're getting very deep into policy actually as well. We are moving too fast in new designs for the COVID vaccine, and we need a very good pharmacovigilance system to track the side effects. Can we talk about a unified, smart pharmacovigilance system in the future?
Yes, I think so. So that is one area that we are working, as I alluded. The same Vaccine Guard platform and infrastructure could be used for that. There are many agreements. In healthcare, it is less challenging to come up with a cool technology. It is usually a domain where several participants need to agree that the governance mechanism of information and agreements, then the way how the technology is being used is understood and then supported by all the others. So indeed, I believe this is possible, and it doesn't take decades to get there. I think this is doable within a year.
We have a similar question that goes in the same direction. The solution needs an international agreement from part of each state. How to make sure that the solution would be spread globally? Do you think there are already some sort of initiatives, or there is political goodwill there?
Yes, well, that's why we have taken the tedious way of working with the WHO. I can tell you, I've never seen WHO to work so fast. Also, the governments, I think every government is held accountable by the citizens to finding the right solutions for the epidemics. Vaccination is not the only one. So we are already, executing and practicing certain measures. So that I think that the governments want to do it. Second, if the solution doesn't require building new IT infrastructure, so if the friction is low, it is possible. And then the first countries, what we call pathfinder countries, are gradually joining, and the next would come. So the example of the others would hopefully also bring everyone on board, or at least most of the countries on board.
It's about generating that critical mass so we can get other people to join for sure. And now you did mention in your presentation the importance of border guards and implementing such solutions as well. Another question comes with one upvote as well. Are airline carriers involved in the possible solution? They may consider to allow passengers only with a negative COVID test to board the aircraft. So do you think that that could be another stakeholder in this?
Yes, by all means. So we are talking not only airline carriers, we're also talking Estonia has a border with sea, so many of our neighbors actually can be reached by ferries, so we're talking about with the ferry companies. So indeed, they are yet another participant in this ecosystem that needs to understand how and in which way this solution, in addition to all the others, helps them to get back to the business and back to normalcy.
Very well. We'll try to make it 2 more questions, but we'll see. How do you manage or handle your applications data when the patient is in isolation ward or in a remote location?
Okay, so first of all, the data first starts with the healthcare provider. So if they are hopefully under good care of that healthcare provider in isolation, so that is where this information is first. Then, when they go out of the hospital and are in isolation on their own, then again, either the hospital will give them a paper with them, or if they have a digital tool to process that, then it could be also on their computer or a mobile phone. So again, the data is first with the healthcare provider, and second copy is only with the patient themselves.
Absolutely. The final question that I would mention right now, I hope I understand this correctly. I believe that KSI blockchain is not a public blockchain. Is there a good URL website to learn about KSI blockchain to use the e-healthcare system?
Yes, indeed. I do believe that it is available on e-Estonia website. It is also available on the website of Guardtime. And if you have more specific questions, please join the breakout session, and I could give you maybe some more details in addition to that.
Thank you very much for that very kind plug to the e-Estonia.com website as well, where we have plenty of fact sheets and Q&As to all sorts of different topics. Yes, e-health, but also many other things, ranging from e-justice to online voting and many other things. Ein, thank you so much for joining me on stage. It was a pleasure to talk to you. And we are slowly moving towards the next presentation. But again, you know the drill. Before we do, we take a look at our next polling question. And the question is, what is most important for a good healthcare system? Is it the quality of treatment, accessibility of services, reliability of information, data exchange between hospitals, or that an apple a day keeps a doctor away? There are many good answers here. I know which one I would vote for. So please vote. And also, of course, for the next presentation, please add your questions in the Q&A section and upvote other questions that you would like to hear the answer to, as you have done so actively over the last few presentations as well. Without any further ado, let's take a look at our next presentation. It's done by Kristi Poor, who is a partner at Helmes, and she will talk about what healthcare innovations Helmes brings into the sector itself. Let's take a look.
Meet 3 Estonian e-citizens, Lee, Martin, and their son, Hugo. It's been a few weeks since Hugo broke his arm. His family physician removes the cast and discovers a strange rash underneath. She consults a dermatologist using e-consultation. It's an efficient way for a family physician to consult with a specialist and save everyone's time. The dermatologist, who can also access the medical records about Hugo, gives recommendations for further treatment. This provides the best possible care, and Hugo is glad he's well again.
Hello. Thank you for the opportunity to be here today. And thank you all who took time to participate in this online event, wherever you are, at your home office, home, or hospital. In the next 15 minutes, I'm going to share with you the story how Estonia's largest hospital is serving 30,000 more patients annually with the help of Helmes software. What kind of company is Helmes? We are located, our headquarters is in Tallinn, but our offices are worldwide, from San Diego to Riga, from Minsk to Mumbai, and it's 900 of us. We build mission-critical solutions, and healthcare is definitely one of them, the most mission-critical. In 2011, we launched first in the world digital prescription. This e-prescription is today really widely in use. More than 90% of Estonian citizens are using e-prescription today. We also got back then Innovation Award for this solution. But much more important than any award is the knowledge and the knowing and the fact that the solution is up and running and you can rely on it. We have built also hospital solutions, general practitioners info system, patient portal, coding center, many others, and also e-school health solution. Did you know that all Estonian students, their vaccination and health data is stored in Helmes built and run solution? It's school health info system. Today's focus is on hospital solutions, and my next slides are about the solution we have built for Estonia's largest emergency-focused hospital, Northern Estonian Medical Center. So, what was the problem we started to solve? A few years ago, there was not a very good booking solution available, and as side effects were that very expensive medical devices, such as MRT devices or computer tomographs, were not used efficiently enough. And also really valuable doctors' time was also not used efficiently enough, because doctors were waiting for the patients who were late or waiting for the patients who actually never arrived, because they just forgot they had an appointment. And in the same time, we had a long waiting list of patients. So, what did we do together with the hospital? We analyzed the situation and we created a solution. We found out that digital booking system is exactly the solution what we need to implement. Digital booking system together with the self-service environment. I could actually log in to the system and find any doctor I would like to visit, to find the date and time and book it. It's done. It's really easy. We also implemented SMS notification. And this SMS notification is great because it's impossible to forget when is your doctor's time visit planned. You will get the SMS before, a day before the visit, and also on the same day in the morning. What else did we do? We centralized all the device bookings, and we centralized also data of doctors' bookings available time. In some extent, doctors were able to have double bookings, but this was only for the doctors. And we also reserved 10% of the time for critical patients. So, what was the outcome? What was the result? As you can see, the number of computer tomograph studies grew rapidly, from around 200,000 studies per year to around 450,000. Growth 67%. And when we look from the number of patients, it also grew rapidly. And this is actually most important because every number is a person. So basically we can see here in this case study that with the same number of doctors and with the same number of medical devices, it's possible to serve 30,000 more people annually, and with just the help of clever IT solution built by Helmes. But actually, when we look, it's really not any kind of rocket science solution. It's just a online booking solution. But these kind of small solutions, step by step, when we go, it's possible to make hospitals also so much more efficient and to help hospitals to realize their full potential. This, what I just described, was only one module. However, we have built many of modules, from resource management system to cancer treatment, surgery planning, and emergency solution. For instance, when the ambulance car is on the way with the patient, there is a constant data exchange. It's all going online, and the hospital already knows what kind of situation does the patient have and what is the status. Is the patient like a red, yellow, or green status? And based on that, hospital is preparing all the needed equipment at the hospital. And many other solutions. We have built 20 plus modules. So, smart selection of tools. This is also one of the modules we have built for hospital. Can you imagine that when you go to your doctor and instead of start talking to you and asking, how are you? Doctor is actually busy with the gadget, just adding data or trying to find the right information. This is definitely not what we would like to experience, none of us. And this is the reason why we actually created, together with the hospital, smart selection of tools, which would allow doctors to concentrate on the patients, concentrate on us and our problem and how we get healthy and well again. So smart selection of tools has exactly this kind of information which is relevant for the doctors. And the good thing is that each doctor can actually design and create exactly this view, what they would like to have. All the doctors and nurses and all the medical personnel could have it the way how it's most convenient and suitable for them. Cancer Consilium solution. Actually, when we initially started to create it, it was of course not the pandemic time, and the most important thing was to have effective online tool to take decisions and to decide what to do with the patients next. But now, in pandemic era, so to speak, there is also much more in these kind of solutions, in these collaboration tools. Although it would be nicer than ever now to have everybody around the table and to discuss about the things. But now these online tools are so much more important, and Cancer Consilium tool is one of them. So basically, the best fit for our hospital solutions is for the hospitals who really have like emergency focus, and for whom it is very important to have systematic approach toward patients, and who require to have more efficient usage of doctors' time and also usage of medical devices, and who is really considering to have digital collective decision-making tools. We truly believe that each patient should have a right treatment at the right time and in the right place. And that's the reason why we work together with hospitals and help them to deliver it. So, as you can see, even with the small steps, when you implement just one module in your hospital, it's possible to help so many people and perhaps also save some lives. I'm happy to tell you that during the breakout session, I have my great colleague Kaiko Kell here with me, and he's going to guide you through 7 modules we have developed for the hospitals. He's really the professional. He's working with the hospitals absolutely every day, and there is no question which is too technical for him. So, yeah, thank you so much, and see you during the breakout session.
Well, Kristi, thank you so much for that presentation. And it's always good to see how exactly the solutions work, also for the customer, but also for the hospital that is working on it. So before we turn to the questions from the audience, we did have a poll to the audience as well. What is most important for a good healthcare system? Quality of treatment, accessibility of services, reliability of information, data exchange between hospitals, or that famous apple that keeps the doctor away?
That would be great to answer myself also. I would take the apple, of course.
If the apple could solve all the healthcare questions around the world, I'm sure we would not talk about e-solutions, but they are necessary whether we like it or not, because the apple does not do all of the work.
Unfortunately, yeah.
But we've got plenty of questions from the audience, and again, I'm so grateful that you're being very proactive here. Some of them are more technical, some of them not so much. The first question that I would want to get to is, can you implement the e-prescription without the X-Road and an electronic ID?
Yeah, that's a good question. Actually, I think there should be possibility to implement digital prescription without X-Road, but yeah, it really depends, because there is no other country exactly like Estonia and like Estonian solutions, and this digital prescription could actually mean country by country something different. So I believe the answer is yes. But of course, there are so many details, and yeah, we definitely need to discuss.
It's certainly on a country-by-country or region-by-region basis, even in some countries, thanks to the federalized structure of it all. But yes, good question. If a hospital wanted to implement these solutions, what kind of process should they expect? Is it more of a plug-and-play solution, or is it a longer process that takes a bit more time?
Yeah, it's a good question as well, because actually you could start small. You could just actually take one of the modules, for instance, like this booking solution, and start really easily and start from the smaller module and go step by step. And I think, but of course, yeah, it's possible to do it like a big bang, although I think I would suggest rather to take it step by step.
I think what we've seen in Estonia as well is that organic growth is usually more helpful for the end users, both in the hospitals and also for the citizens, because if you present them with 100 new online services today, they will not understand all of them at the same time. So better start with something and then build from there. And also the good thing is that you could start with one hospital as a pilot project and then scale that up for the rest of the region or the rest of the country, depending on how big your country is. Something that goes more in the medical direction. Do all the different hospitals in Estonia use the same EMR, like all the different hospital machines? Are these provided by the government, by the ministries? Or do they all have their own systems and technologies in place?
Yeah, unfortunately, I do not know the answer for that question. But yeah, we can certainly find out. But yeah, I don't know.
I'm sure that also for the breakout session we will have some of those answers ready in case you want to go more into detail. How does your application manage or behave when there is no ICU/ICCU room available, whereas the critical patient in the ambulance is on the way to the hospital? Would the solution divert to another nearby hospital or hold?
That is another answer, or that is another question what we should bring to the breakout room, and then my colleague Kaiko could take it.
Absolutely. Not every citizen has a smartphone or PC. How do people like that access healthcare in Estonia?
How can they access? Well, And the question was like, if they
if you don't have a computer, if you don't have a smartphone, what do?
You call.
I was about to say the same thing. The good thing about...
Or you go there, of course, during the pandemic time, that would be a little bit difficult because they just accept only pre-booking and agreement beforehand, you physically go somewhere. But you can just use the ordinary phone and call because this so-called analog option is still there. You can still kind of take your phone and take a number and call. And it still works.
I think this is something that we need to talk about more as well. In the worst case scenario, if you don't have a smartphone, if you don't have an internet connection, the worst thing that can happen in Estonia is that it works just like in every other country in the world. That's the bottom line. So it's only up from there. And of course, there are still people working in these different offices and buildings and in the general practices and so on. Another question. If so implementing such a huge system in a hospital is quite often a challenge. What was the end user's feedback, and how did the implementation with the doctors and nurses go?
Of course, every change of behavior, every new thing, it takes time, and it's a challenge, and it's not easy. If you need to do something in a different way and you have a new habit and you start eating less and exercising more, it's not easy, right? Theoretically, it's very easy. But really, of course, it takes some time, it takes some energy, but it's all worth it because as for every doctor and every nurse, it is important to help more people and save more lives. And we can clearly see that IT solutions help them in this hard work, what they do day by day. So they do it, and I think we all should be proud for the work.
I think change management is usually not about the technology. The technology can be uploaded within 30 seconds.
Yeah,
but
you're right.
the question is, number one, the legal frameworks. Is what you're trying to implement even possible in your country for data exchange and many other things? And the second question is, of course, how do the people react to this stuff? And I think this is, again, this organic growth, not just for the end users, but also for the people in the hospitals. If you've been a practicing doctor for 20 years and all of a sudden there is this new online format, even if it is very user-friendly and the people know how to use computers, it will still take some time to get used to it. You're
right. And of course, there is always transition periods when you can use paper and also digital options, but very soon everybody will go towards the digital option because then all is in the system, all is transparent, all is there, and actually it is less work. So that's how it works.
Wonderful. Well, thank you so much for your insights, Kristi. Before we head to the next presentation, we have another polling question for you people at home. The question is, how far is the nearest pharmacy from your home? Is it A, I live next to it, which would be very, very useful in times of crisis? Is it less than 100 meters? Is it half a kilometer or more? Or do you have no idea where the next pharmacy is located? I live quite close to one, but I'm sure that depending on how rural your home region is, it might be a bit more tricky than that. So please give us your answers, and in the meantime, we will start with the introduction video for the next presentation. We will have Taavi Einaste on stage. He is a partner at the company Nortal, and he will talk about building seamless healthcare. Let's take a look at the video.
Nortal is a global digital transformation powerhouse of 1,000 experts in the US, Europe, and the Middle East. Known for being one of the main architects behind Estonia's transformation into a globally renowned digital society, Nortal's vision is to create a seamless society where all communications, transactions and services are effortless, leaving time for things that truly matter. We work with leading governments, healthcare institutions and businesses around the world helping them simplify and optimize complex processes to tackle the challenges of today and build the future together.
Good morning, good afternoon, or good evening, depending on where you are, also from my side. I'm extremely happy to be here, happy to see all of you joining us. Well, actually, I cannot see you, but what the organizers are telling us that there are so many people watching that we're really glad about this. So we'll talk about building seamless healthcare. What does that mean? How have we done this before? And how do we see the relevance of the Estonian experience here? Nortal is a global company, and we've been building digital healthcare solutions for over 20 years across Europe and the Middle East. And moving into our subject today, of course, we are focused on the future. So what do we think the future of healthcare will look like? I think we are all on the same page that that healthcare in the future has to be patient or user-centric. But what does that really mean? So first of all, our previous presenters have also outlined that we are living in an era where the demand for healthcare is ever increasing. So we have increasing population, we have aging population, we have more people with chronic disease. At the same time, we also have a situation where the expectations of the population for healthcare are increasing. You know, we live in an era where we're able to get cars or electric bikes with the push of a button, and we see pictures across the globe being uploaded and shared with family and friends. And this all plays into the expectation of the population, where we really expect the healthcare system and governments provide better care. We see technology advancing and we want to use it. So this, of course, puts enormous pressure on the healthcare system from many sides. On the other side, also, supporting the user, we have an increasingly complex situation with regulation. And regulation very often is connected to data. And when we come back to the original thesis that healthcare in the future should be or has to be user-centric, then let's ask ourselves, who or what is a user today? Maybe 20, 30 years ago, the patient or user of healthcare, was the physical person with their needs, wishes, hopes, with their family. But increasingly, we have to define the patient or the user also through the digital data that we have or they have about their own healthcare. So think about it. We also have the same situation outside of healthcare. I'm a person, but then I have this digital twin on Facebook or Instagram, and maybe in the future on TikTok. But we have the same situation also in healthcare. So when we say that the future of healthcare has to be user-centric, we really have to understand that this is not only about the physical person, but this is also about the data which is connected to this patient. I will talk mostly about digital prescription or e-prescription, depending on how do you want to call it. Why electronic prescription? So we had a wonderful presentation also from our colleagues previously describing how prescription was built in Estonia. And I really believe that when we are building digital healthcare or a digital society at large, then prescription is a wonderful way how to go about it. So first of all, prescription, it's a very, very high frequency service. I think we all know that most of us use prescriptions pretty frequently. Is it for ourselves or for our children, for our parents? but this is something we are all connected to. Anna mentioned in her presentation that more than 90% of the people in Estonia are using electronic prescription. I think that's a very, very high number for a country where, you know, a really high percentage of the population is using a digital service. So this is why I think it's a relevant topic to talk about. There are a couple of other reasons why we think prescription is a really good topic to cover, and we'll later have time to go into more details during the breakout session as well. So if you're interested in that topic, please join us there. But one of the elements of, or one of the characteristics that makes electronic prescription really special is that it's relatively independent as a service. So you can live in a country or in a region where most of healthcare is on paper, but it would still be possible to implement electronic prescription or digital prescription. And why is this? Well, if we look at the setup of a prescription, so this is something that's initiated by a patient. So I have a problem, I have a need. Sometimes it's something that, you know, is coming up today, but very often, because of especially for chronic patients, this is something that happens regularly. So there is a specific need, a specific process for me as a patient to go through. And in order to do this, I have to connect to a medical professional. So this is typically a doctor, but in some cases, let's say for repeat prescriptions, it can also be a nurse or a caretaker. And the first thing that we are looking at is, you know, how do I do this? Of course, traditionally, I go there. You know, I go to see a specialist. Increasingly, we have opportunities to do this via telemedicine or, you know, simply calling. And all of this is something that we can digitalize, not digitalizing the whole country. So, you know, I'm at the specialist, I'm talking to the specialist on the phone. They want to give me a prescription. So what do they have to do? So there are a couple of things they need to know. So first of all, they need to know, you know, what is my situation? You know, what's my concern? In an ideal world, you know, they have access to all of my medical records. But in case that's not possible, I mean, in any case, they would give the prescription based on the input from me as a patient. So this can be done in a highly digital environment, can also be done in a very paper-based environment. The doctor would need to also, you know, figure out what kind of drugs are available for prescription. You know, traditionally, they would write it on a paper. In a digital environment, you know, there's a list somewhere. So they're able to, you know, select what is the best medicine from that list. Again, can be done in a fully paper-based environment, can be done in a very highly digitalized environment. Next step, I go to the pharmacy. Pharmacies would need to have some level of internet connectivity, as would the doctor, obviously. But most pharmacies, they already have some kind of digital systems to keep track of their inventory situation and billing. And it's relatively easy to add a simple functionality to those systems to check for prescriptions. So what we have seen, well, first of all, in Estonia, but other countries as well, that it's possible to implement electronic prescription both in a highly digital environment, but also in an environment which might not be as digital. So this is why we think it's a really good example when people are thinking about building up digital healthcare. We also see that electronic prescription, especially in situations when we are maybe building it up in a more paper-based society, it can be a wonderful first service which can be expanded later on. So if we think about an example where electronic prescription is built up in a mostly paper-based environment, so what does this actually require? It means that we have to set up at least basic registries for medical professionals, for drugs that are allowed to be prescribed, for pharmacies, and for medical practice locations. So these are all excellent building blocks for the future. So if you have those building blocks in place, you're able to move on to building medical health records. And I saw in the beginning of the transmission today, there was a poll about which of the digital healthcare services is the most important, and the majority of you voted for medical records. So I would kindly disagree here. I think electronic prescription is the most important one, because I think this is the quickest way for a society to deliver a real impact to the people with reasonable investment. So this is my take on here. But basically, if you look at the building blocks that you need for a digital prescription, you can see that based on those, you're able to move into telemedicine, you're able to move into medical records, you're able to move into digitalizing ambulance, you're able to really make people want to use telemedicine. So there's a lot of services that you're able to build after you have done electronic prescription. So I think if there's something that you take away from this presentation, this is one of the topics. But okay, let's look at a couple of case studies as well. So before I jump into the cases that we've prepared here, I would really like to highlight something that the previous presenters have also brought up really well in their respective discussions. We are all very happy that you have joined us to learn about digital healthcare in Estonia, and how Estonia has built this miraculous infrastructure, I would say. But I think it's also increasingly important for everybody to understand that we are not suggesting that everybody should be like Estonia. And I think, at least us as a company, we have learned this the hard way. So, we have been international for more than 15 years. And in the beginning, of course, we were extremely enthusiastic about doing the Estonian thing globally. Very quickly, we realized this is not going to work. So I'll show you a couple of cases where we have succeeded. So we have taken the Estonian experience, taken it into an absolutely different context and made it work. And I think this is really the inspiration that I hope you take from this session, that the Estonian success story can be implemented in absolutely different circumstances as well. So first, Germany. Clearly, there are similarities and big differences between the countries. So generally speaking, our legislation is very similar with Germany, but there are important differences. So first of all, Germany obviously is a larger country, but it also has a very federal structure, meaning that there's a separation of decision-making on the federal and state level. Germany also has a different setup, especially, I would say, in terms of the expectation of the society to data privacy. So, as an example, if we look into the prescription system that we have set up in the federal state of Hessen with partners, one of the elements when we jump back into being user-centric, if we want to use data to provide better healthcare, then of course this data has to be available for the stakeholders, meaning the doctors, potentially pharmacists. In the German context, there's a lot of care taken into, if I'm a chronically ill patient and I might have 4 or 5 different prescriptions active at the same time, I also might be battling depression, for example. So if I go to my pharmacist and I want to get the 4 prescriptions for my chronic disease, but I don't want the pharmacist to know that I'm working on my depression as well at the same time, because it might be the only pharmacy in the village, and I don't want that person to know that I have depression. So in the German context, the systems are designed in a way that the user has to have maximum control over what type of data are the stakeholders seeing. And of course, with digital tools, this is relatively easy to do. What we have to understand, obviously, is that there's a trade-off. So in a situation where potentially I'm not showing all of the data to the doctor or the pharmacist, they're also not able to utilize this data to advise me. So this is a trade-off, clearly. And to really show the difference here, so another case, this is in Abu Dhabi, where we built the prescription system recently with partners there. So the business goal here was very different. So the business goal here for the regulator was to really support the population in the situation where the controlled medications might be harmful. So people get very strong painkillers, and there's a possibility, as we know, globally, that it's an epidemic, that people might get hooked. So, how to make sure that we are protecting people from this type of, let's say, potentially we could call it a failure of the system even. And here, in order to do this, obviously, when we are allowing the prescribing of controlled medication, we need to know, or the system needs to know, when was the last prescription done, and calculate, so that it doesn't become too frequent for the person. So a very different view into this paradigm of privacy versus using the data for the benefit of the patient. But my message here is that both can be done. So this is obviously a matter of policy choice for the regulators. From a technical perspective, we are able to always build it both ways or some other way. Before we jump into the question and answer session, I really liked what Ain was presenting earlier about the cooperation with WHO. So we are working in the same field and a little bit different focus. We also work with the PCR testing that is going on today, and we really think that if we want to return to some kind of normalcy with travel, we really need to have a solution where people can be tested before they board a flight or they join an event. And if you're interested in this, also more information available during the breakout session. Thank you very much.
Well, thank you so much for your insights. We will move to the Q&A session in just a second. Before we do that, we have to take a look at the last poll for today. The question was, how far is the nearest pharmacy from your home? We got around 60 answers from the viewers. Only 3 people said, I live next to it. 16 said less than 100 meters away. 35, that's almost 60% of the people, said half a kilometer. And there are 5 people who say, I have no idea where the closest pharmacy is. What's the situation for you?
I was just thinking about this when you said it, and I think it's about 40 or 45 meters, so it's really close for me.
That's pretty straightforward. Yeah, it's for me it's around 500 meters, but just about. So I think that's also quite doable. We've got plenty of questions also referring to your presentation. The one that got the most upvotes is you implemented e-health solutions in Germany and the UAE. Those are 2 very fundamentally different countries in different stages of digitalization. What were your lessons learned from these 2 examples?
Well, I think that I chose those examples exactly because of this. So they're extremely different because of multiple reasons, the political system and the level of digitalization. So we can look at Dubai and Abu Dhabi, which have a lot of very advanced systems. And I think what we have learned is that in both countries, regardless of the political system, regardless of the state of digital and advancement, there are always people who want to do things and there are people who don't want to. And I think what's really important is that you try to find more of the people who want to do things and you try to manage the ones who don't.
Yeah. Absolutely. Coming from Germany myself, I can certainly agree that there are a handful of people that are maybe not as excited about digitalization as people in Estonia, and obviously also you, the dear audience.
But if I may jump in, I think there's a fundamental shift that has happened, and I think if there's one positive thing that comes out of this COVID situation, I think that also people in Germany, which is also my main workplace, they have really understood that the lack of digital is a bigger risk than having digital.
You took away my next question.
I'm sorry.
The question was actually very much connected to this. Have you seen an uptake in interest in e-health solutions since the start of the pandemic? Maybe you can talk about regions as well, some sort of insights there.
Sure. Well, I think that if we talk about digital, then of course COVID came as a huge shock for everyone. And it took several weeks for both companies and governments to understand what's going on, organize themselves in terms of working from home, etc. So we saw a huge drop in calls or emails about new projects in March, for example. But increasingly after this, both in the public and private sector, we see that there's an urgency of being more digital. We see it in healthcare. We see it in Germany, but we also see it in other regions. We see it on the private side. We see it, big American companies who maybe run theme parks. They're trying to figure out how to survive this era. Yeah. And of course, we see it in healthcare. I think that this is such a perfect storm for healthcare. So you need more healthcare, but you cannot see the people. You don't want to have a lot of sick people in the waiting rooms. So everybody's trying to understand telehealth. How can we be more away, but still help people?
Of course, every single case of COVID-19 is a tragedy in itself. But I couldn't agree more that for this sector in particular, it might have been some sort of renaissance, that all of a sudden people realize that digital is no longer a gimmick. It's rather a factor of hygiene, actually.
Absolutely.
We're usually being asked at the briefing center, what if the online services don't work anymore? Well, now we get to ask the reverse question, what if the physical services don't work anymore? So absolutely, very good point. There are two questions that are referring more to the current situation in Estonia, if you would allow me. The first one is as follows. If I go to a doctor and he or she issues a sickness certificate, does Nortal software allow to send this sickness certificate to the national insurance or the social security system automatically so I get my sickness benefit? What kind of data format is it? Is it XML? It's basically about the service provision, automatic money transfer and so on. How does it work in Estonia?
The automatic transfer is possible. So basically what is considered in the process, and maybe I would enlarge this answer a little bit outside of the very specific use case. So the Estonian government in general is trying to find ways how to be more efficient. And a big part of it is what we call services that are, so we say it like this, that the best service is no service. So, because if you think about the same example that the audience is asking for, so why I go to the doctor, I have a problem, I'm sick, so why should I spend energy, bringing some piece of paper or sending an email to somewhere? So we want to eliminate all of this, and I think this is a principle that increasingly is used across the board in public administration.
We're talking about proactive government services.
Exactly.
We're talking about the use of AI in voice assistants. There are many, many different things on the. Some are on the horizon, and some are very much being rolled out as we speak. Very true. The second question that relates to the Estonian experience. Maybe it would be useful for the audience to get some information on the healthcare system in Estonia, insurance, big players, reimbursement, related to the digital solutions that are already implemented. Can you give us a quick overview of how it works if you're a patient in Estonia?
Okay, so I think that first of all, we have a single payer system, which arguably makes some implementations easier. But for me as a patient, I'm able to interact with most branches of medicine online or digitally. Obviously, in certain situations, I would have to go there. I want to go there. The data between institutions always moves digitally. So if I get an X-ray in a private clinic, for example, and then I go to my governmental hospital to have a knee surgery, then there's never any papers or CDs with X-rays. So data between institutions always moves digitally. This is has been like this for a long time. Something that I might not see, which is kind of hidden from my side. Of course, the doctors and the hospitals, they have to get paid for their services. So this data moves digitally as well. What I think is really cool about the Estonian system is that in case the public insurance has paid for my health, let's say a surgery or something else, I am able to see how much that cost. And I think that it has several wonderful side effects. So first of all, the national insurance company has effectively crowdsourced the auditing of healthcare bills. And we have certain cases where people have noted some irregularities and they're able to investigate. But I think on a philosophical level, especially in a single payer system, there's a feeling that healthcare is for free, which is, of course, it's not. And it really helps to understand that, me going on a skiing trip, breaking my knee, really actually cost the taxpayer a lot of money in the end. So.
It very much puts it into perspective, how much you paid into the system, what you've gotten out of it throughout the years of breaking legs on ski trips and so on.
But
yeah.
If I just make a couple of other things which I think are very important and useful in Estonia. So I have 2 underage daughters, and I'm able to see their health records. I'm able to get their prescriptions. If I would have an older relative who would require assistance, they would also be able to grant me, let's say, limited or full access to their health record. I think these are also things that really drive home the user centricity, because they really help families.
Absolutely. One last point that we can probably, it's a bit of an open-ended question, but that we can probably deal with quite quickly. In telemedicine, what are the types of diseases and conditions that could be effectively diagnosed and treated? I mean, obviously you can't cure the leg, like the broken leg, via Skype, but what do you think is the most useful field of application?
Well, I think we're already seeing this. So also in Estonia, for example, skin diseases, etc., etc. I think also that especially at a time of, let's say, we can say COVID or regular flu, but if I have a video call with my doctor and I'm sneezing, coughing, I have a temperature, I think they can make the diagnosis with a high degree of certainty about what's happening without needing to see me. And even if they are wrong in a couple of cases, which of course is not good for the patient, but overall, not getting those people into the doctor's office really helps. I think that there's an increasing number of diagnoses that can be done effectively, but this also comes down to having potentially, let's say, wearable or home devices for simple measurements. So that will help.
Yeah. Absolutely. Taavi Einasto, thank you so much for joining us from the company Nortal. And to the dear audience at home, in the hospital, at the office, wherever you are, I will stop torturing you with more polls right now. And in my opinion, we're getting to the, even though the presentations were very interesting, we're getting to the most exciting and engaging part, namely to the breakout sessions where you can ask the experts from the 3 companies that were present all the questions that you still want to have solved, and you can also have later contact with them via email and other mediums. A quick summary from my side. It just says wrap up here. I think the main realization, the main takeaway that we can have from today's event is that you don't have to digitalize the entire healthcare system today. That is, first of all, it's physically impossible. It's humanly very difficult because people would have to get used to 100 different services all at once. For some countries, it might be financially impossible as well. Although we should note that digitalization in the medium to long term certainly saves more money than you spent on it at the beginning. So be daring. If you run a hospital, think about implementing a pilot project in one of your wards. If you are working for a regional government institution, you could think about piloting a project with one of your districts. There are many ways that we can advance digitalization together and also work for the health, for the well-being of all citizens and residents in our countries around the world. I highly recommend that you stay in touch with us at the Estonia Briefing Center. You can always go to e-Estonia.com and book a presentation with the digital transformation advisors. We also have lovely people there that work on the business management side of things, where we get you in touch with all the different companies in Estonia that have already created solutions that have been working for several decades in some cases, and you can get their know-how and implement that stuff in your home country as well. Without any further ado, I would like to recommend you to switch into one of the breakout session rooms with Nortal, Helmes or Guardtime. I wish you that you will stay healthy, in the COVID test sense, stay negative, and always keep a 2 meters distance at the very least. Stay safe, stay healthy, and have a wonderful time with our 3 breakout session rooms. Thank you very much from our side, and have a good day.